The new Frontline. U.S. military tests MDMA therapy for active-duty soldiers. The United States military is preparing to launch a controversial but potentially transformative initiative, using MDMA-assisted therapy to treat post-traumatic stress disorder, PTSD, in active-duty soldiers. This marks a significant shift in how the Department of Defense, DoD, approaches mental health, moving from historical suppression of trauma to proactive pharmacological intervention. Beginning next year, 186 service members will participate in 2 DoD-funded studies designed to test the efficacy of MDMA, commonly known as ecstasy, in treating combat-related trauma. The goal is twofold: to heal soldiers suffering from PTSD and to potentially extend their operational readiness. However, this initiative raises profound ethical questions about the nature of military service, the limits of healing, and the moral implications of returning treated soldiers to the battlefield. A bipartisan push for mental health innovation, the push for psychedelic therapy in the military, has gained momentum across the political spectrum. Funding for these studies was secured under the National Defense Authorization Act in December 2023, signed by former President Joe Biden. The provision was mandated by Republican Congressman Morgan Luttrell, a Navy SEAL veteran who has personally undergone psychedelic therapy. "Our men and women in uniform deserve every tool available to heal and stay in the fight," Luttrell stated at the time. This is just the beginning. This bipartisan support was reinforced in April when President Donald Trump signed an executive order aimed at accelerating psychedelic research and widening access, particularly for veterans. Highlighting the human cost of untreated trauma, Trump noted that since 9/11, over 21 times more veterans have died by suicide than in combat. How the studies will work: the research is being conducted by 2 major institutions: Walter Reed National Military Medical Center, treating 91 military, Guard, and Reserve personnel; Emory University, collaborating with the University of Texas Health Science Center. Participants at Walter Reed will receive 3 separate MDMA doses over a 10-month period. Crucially, these soldiers will not be deployed during the study. This restriction is vital for safety and data integrity, though it remains unclear how long after treatment completion soldiers must remain off-duty before returning to active postings. If the results are positive, MDMA-assisted therapy could become a standard part of military mental health care. Rick Doblin, founding president of the Multidisciplinary Association for Psychedelic Studies, MAPS, advocates for even earlier intervention. He suggests incorporating emotional training and MDMA sessions into basic boot camp to help recruits process pre-existing issues, potentially making them more resilient to future trauma. The ethical dilemma: healing versus combat readiness. While the medical benefits are promising, the ethical implications are complex. Critics argue that using psychedelic therapy to fix traumatized soldiers so they can return to war is morally questionable. Dennis McKenna, an ethnobotanist and author, warned against this potential misuse. It would be completely cynical and cruel of the government to throw them back into combat. It's an abuse of psychedelics to use them to reconstruct people so that they can become more efficient killing machines. There is also a clinical concern regarding relapse. Doblin acknowledges that patients are more likely to experience PTSD symptoms again if they return to high-stress environments immediately after treatment. However, proponents argue that untreated trauma is far more dangerous. Rachel Yehuda, a psychologist at Mount Sinai, notes that treatment can have varying effects. Some soldiers may question their service, while others may find their sense of mission reaffirmed. She emphasizes that treating trauma while it is still ongoing in an active-duty setting is distinct from treating it in the aftermath of military service. Historical context and global precedents: the U.S. military's interest in psychedelics is not entirely new. In the late 1950s, the Army conducted classified experiments with LSD on soldiers to assess its potential as a chemical weapon. Unlike those coercive early tests, the current MDMA studies are voluntary and focused on therapeutic healing. The U.S. is not alone in exploring this frontier. Ukraine, amidst its existential conflict, MAPS has trained 55 therapists to facilitate MDMA sessions for Ukrainian soldiers. While MDMA is not yet legal for medical use in Ukraine, hundreds of troops have already received legal ketamine therapy to manage PTSD and return to the front. Israel, a major study involving 168 participants, including military veterans and active soldiers affected by the October 7 Hamas attacks, is set to begin dosing later this year. This trial aims to create a model for treating collective trauma. Addressing moral injury, a persistent concern among critics, is that psychedelics might allow soldiers to erase moral injuries, the psychological distress resulting from actions that violate one's moral code, such as committing war crimes. Doblin counters this by arguing that MDMA does not erase memory or conscience. Rather, it helps patients process difficult emotions. He suggests that untreated soldiers who suppress these feelings may become more dangerous. A lot of times, people become more sensitive to the emotional consequences of what they did, Doblin said. If they're not treated at all, I think they're more dangerous of a soldier that way. Conclusion: the upcoming MDMA trials represent a pivotal moment in military medicine, blending cutting-edge neuroscience with the harsh realities of modern warfare. While the potential to alleviate the suffering of thousands of service members is significant, the success of these programs will depend not only on clinical outcomes, but also on navigating the delicate ethical balance between healing individuals and maintaining combat effectiveness.